Hi everyone, I'm Pierce from City Pigs, and I'm here to talk to you about a health issue called gastrointestinal stasis. I myself didn't know about this issue until very recently. I would say 1 week ago, when I lost one of my Lungkira, a young Lungkira. She was about a year old, named Elle. She had gone to the vet, a bunch of things had transpired, none of them were correct or good. So hopefully this video will help you when you go to the vet. Please pull this video out and put it in your veterinarian's face. If they have an issue, if they're going to tell you, oh no, don't worry about it, oh it's just this, it's just that, you need to insist, you need to start a fuss, and you need to not leave until they deal with the situation immediately. So what it is when your guinea pig has an issue. So for me, I brought the guinea pig in believing it had upper respiratory infection, possibly pneumonia. The night before I went to the veterinarian, I had a home vet come in who had said that she didn't really see much wrong, but did prescribe Baytril in a pill form, gave me instructions to crush it up, mix it with water, dose her. But the next day she wasn't better, and normally with guinea pigs, as you know, they get sick quick and they get better quick, and she wasn't the next day. So I rushed her to the emergency vet. All other veterinarians were completely booked and refused to see us even for an emergency. So I went to the emergency vet, they scooped her away, took her into the back. I'd explained to the lady at the front what was wrong. Maybe 15 minutes later, I got very antsy and asked the receptionist to get me to the guinea pig, and I wanted to find out what was happening and why she was where I wasn't and what was going on. So the vet came in. She informed me that she didn't see a situation as dire as I did, because I knew nothing about stasis. I knew nothing about that type of issue. That's not what I spoke about. I spoke to her about knowing that she had some kind of infection in her chest. Whether it was an upper respiratory, whether it was pneumonia, I did not know. But that's what I needed her to give me medication for. She ran through a whole bunch of, questions and stuff. Like normal, she asked me what it was I wanted, and I told her, I'm pretty sure Elle has an upper respiratory infection. I hear her lungs rattling, she's panting. The vet informed me that for her, she found that Elle was a little bit cold. Well, I brought Elle in from outside. We rushed her to the vet. And that she was giving them oxygen, which freaked me out because I didn't realize giving the guinea pig oxygen meant putting a little hose in front of their face while they're laying in their carrier. I thought someone was holding it and like trying to shove a mask over her face and stressing her out even more. So I got a little antsy, and believe me, I can get antsy. She informed me to calm down and don't worry, this is what we're doing. She explained, she said, I seem to know what I'm talking about. She asked me if I wanted an x-ray, and I believe the x-ray was for checking to see if she had pneumonia. Now, as far as I'm concerned, I don't need an x-ray to tell me she has pneumonia. Something's wrong. If it's pneumonia, treat it. So she did. She gave me Baytril, she gave me critical care, and she asked me what I was doing for her up to this point. I told her that I had tried giving her some yogurt and some hand feeding. She didn't seem interested. She'd take a bite of something here and there. She didn't seem overly concerned with the guinea pig at all. That night, things didn't get better. I called a friend of mine who's an expert in guinea pigs through a guinea pig rescue. She came over the next day with a whole shebang of things. So I'm going to tell you what those things are, and I'm going to tell you to demand your vet give you these things. So what she brought me was pain meds, motility meds, anti-gas meds. These are all critical things for when your guinea pig has stasis, as well as critical care and hand feeding. So what caused stasis in my guinea pig was most likely either an upper respiratory infection that prevented her from eating, or that first couple doses of Baytril I gave her slowed down her system, and that started it. And then, of course, the next day of putting her on Baytril again, without motility meds, etc., caused a severe problem. Now, stasis, what happens is guinea pigs need to eat all the time. They're constantly eating. They need to have hay. Hay is not something that is optional. It's not something that's suggested. It must be there in order for their system to constantly move. Baytril can cause the contents of the stomach to dry. It slows down the system, the stomach dries. They basically get the way we get when we take a pain medication. You get constipated, except with them, 48 hours they can die. Within 24 to 48 hours, it can be irreversible. You must get your guinea pig to eat every 2 hours, if not more. You must get your guinea pig to be going to the bathroom all the time. The food cannot stay in its stomach or it will die. That is the problem that's happening. Veterinarians aren't knowing about this. We're not knowing about this. This week alone, we know 6. I believe 5 have died and a 6th has been saved because of this issue. The majority of them were put on Baytril for other issues, and were not told, nobody was told, about a stasis issue. One person, their guinea pig, had stasis. They thought it was better. It wasn't. They discontinued, I'm assuming, the medication and stuff, and the guinea pig was not better, and it died shortly after. So I'm going to put up a whole list of things that will pop up while I'm speaking, the name of the drugs, the name of the things you need to do. But it is really important, guys, that if your guinea pig is not eating, whatever the reason, that you act immediately. You must have critical care on hand at all times. I've had people mention critical care to me over the last 3 years 5 billion times, and I never had any on hand, never really knew what it was about. My guinea pigs were never a problem. They always ate. The ones that got sick, I put on medication, they got better. I didn't realize this was an issue. Thank God the people from Piggles Rescue came immediately, and they didn't just tell me what to do, they took action. Kathy took my guinea pig to her house. She immediately started all the things that were necessary, but it was already too late. It was well over 48 hours, and she was past the point of return, and she may have been able to save her if a veterinarian had spoke about this to me. During my consult with the vet, Kathy was texting me to say, ask for motility drugs. When I said this to the vet, she acted as if she didn't know what I was talking about. So I kind of shrugged it off as, well, this would help, try and get this. I didn't take it as you have to have. That's the issue, you have to have. So when you go to a veterinarian and your guinea pig is not eating, you must ask for an x-ray to check for stasis. Say to your vet, x-ray for stasis. If your veterinarian tells you, I don't know what that's going to look like on an x-ray, you need to leave and take your guinea pig to a vet that knows what they're talking about when it comes to this issue. Please understand that through an x-ray is the only way you can tell that stasis has started or ended. If you don't want to do the x-ray, then you must assume they have stasis and you must move forward as if they do. Okay, so please pay attention to what's going on. We know something's wrong with our guinea pigs. When I brought it to 2 different vets, they both acted like I was overreacting, and nothing was really as bad as I thought it was. I know what's bad. I know when something's wrong. We all know. So I don't want anyone else to lose a guinea pig to something that is so fixable and can be stopped. It can be helped. So please pay really close attention to this video. It'll save your guinea pig's life. Bring this video to the vet. Tell them I'm making you force them to watch it. And I'm making you force them to pay attention to what stasis is when guinea pigs come into their vet clinic. Anything can be an issue with a guinea pig. Not eating is the worst issue, okay? All right, horrible message. It's not great. Normally I like to post videos of happy, jumping, cute, fluffy guinea pigs, but this has been a really rough week for a lot of people. All of us have brought our guinea pigs to the vets. All of us have done everything. A number of us have brought our guinea pigs to the vets multiple times, and each time stasis was never mentioned, and we were only informed by Guinea Pig Rescue and the people there that seem to know more and seem to have more experience with these issues. So please pay attention, guys, and hopefully you won't have this problem and it's the last we'll see of this happening en masse like it is now. All right, thanks for watching, and keep an eye on those guinea pigs. Bye.